Yeah, they'll be trickling in. I'll let them in, but also if I start getting any emails on my end, I'll pay attention to those as well.
Cool. So you've started the recording. So good morning. My name is Miguel Lopez. I'm the Public Health Administrator for the PlayStreets program, and I'm also the Community Engagement Liaison for community for CDPH. And joining me today is my director, Yvonne. Like to introduce yourself?
Good morning, Yvonne Stamblin, Director of Community Engagement here at the Chicago Department of Public Health. Good morning.
So today we're going to be presenting on the PlayStreets RFP for the South region and the West region. There's two current bids available for the PlayStreets grant, and as you can see, 57073 is for the South and 58155 is for the West region. Go ahead and move on to the next slide, please. So some just housekeeping rules for today's presentation. This bidders conference is for a duration of 1 hour. The meeting is currently being recorded and will be available and shared through our social media platforms. Um, Please hold off on asking any questions until the end of the presentation. But if you do need to make a note of a question, please feel free to use the chat and we'll address those questions at the end of the presentation. And then again, we do have a question and answer session at the end of the presentation. So the purpose of this RFP is the Play Streets program is a community-centered health initiative designed to increase safe, supervised outdoor spaces for physical activity amongst children and families in Chicago neighborhoods with the greatest health disparities. Play Streets is a childhood obesity prevention program, but it does include other factors such as violence prevention, community cohesion, bringing the community together, and being community, uh, also doing community engagement with the community itself, but the larger network of play streets and the entire city of Chicago. Next slide. So through this program, the Chicago Department of Public Health looks to partner with two delegate agencies to recruit and train 34 community-based organizations. And collectively, we're going to begin hosting 170 play street events across the South and West region, engaging a minimum of 42,000 children and families. These events temporarily close residential streets to traffic, transforming them into vibrant, play-friendly spaces that foster physical activity, social cohesion, and community resilience. And true to CDPH guiding principles, we're looking for delegate agencies or respondents that reflect our guiding principles with trauma prevention, cultural responsiveness, health equity in all communities. When we're talking about trauma prevention, we're looking for organizations that are creating environments and services that actively prevent harm and promote healing by recognizing and addressing the effects of trauma, particularly in historically oppressed communities. As far as cultural responsiveness, ensuring that all the services and programs and communication are tailored to meet the diverse cultural, linguistic, and social needs of the communities that they serve. And when we're talking about health equity, intentionally prioritizing the allocation of resources, services, and opportunities to communities facing the greatest health disparities, ensuring that they're accessing health and wellness for all. So the program model and objectives. So PlayStreet supports CBOs with seed funding, technical assistance, and supervision to plan and execute community activations, these engagements. The primary objective of the program is to increase physical activities amongst youth and families, providing that safe, consistent opportunities for sports, games, fitness activities that align with the CDC's physical activity guidelines. Each region is supposed to host 85 activations per their region and annually across prioritized neighborhoods. So combined, it's 170 events, 85 for the West and 85 for the South. These events are supposed to foster social cohesion and community engagement, strengthening the local networks by bringing together neighborhoods or neighbors, CBOs, and other city agencies. Support the culturally relevant programming that reflects the community they prioritize, And then building organizational capacity, expanding the CBO's abilities to independently host health promoting events. This in itself enables long-term scalable use of play equipment and community resources beyond the funding period. So PlayStreets specifically focuses on the summer months, May through September, but with this technical support and building capacity is for the organization to be able to have activations or events beyond PlayStreets throughout the entire year. So the responsibilities of the program, the two delegate agencies are responsible for providing full cycle management of the program, ensuring that the creation of safe and active community spaces for youth and adults during the summer months. Those key responsibilities consist of recruitment and training of CBOs, providing support for those CBOs whenever they run across any type of issues, coordination with the city departments to make sure that aligns with the CDPH's mission, and also current campaigns that the CDPH may be promoting, like immunization and vaccination. For example, like COVID rollout, to also supporting some of the other city agencies campaigns that they may have going on at the current time. Logistical management, as far as coordinating the street closure, health and wellness and activities, and also the administration of the program. So in regards of total funding, there's a total funding of $500,000 being provided by city funding. And this is for the implementation of PlayStreets in both the South and West region. Under this RFP, we anticipate awarding one grant of $250,000 per region to a single respondent who will be responsible for the coordination and implementation of the PlayStreet activations in each region. While funding may be available on a year-round basis, program activities are expected to take place from May 1st of 2026 through September 30th of 2026. The contract renewal is possible for up to 2 additional periods, but each period not to exceed 1 year and contingent on funding availability and prior program fiscal performance. And as always, CDPH does reserve the right to change or add funding source as necessary. So there may be opportunities to add additional funding as it becomes available through other grants, other partnerships, and even sometimes in some cases being able to add some supplemental funding that may be coming in from a collaboration with another city program. Scope of services. The program delivery target is to conduct a minimum 85 PlayStreet activations in each region. That's 107 total. And servicing 42,000 children and families, with the majority of the events held between June to September to align with the school break. The activation standards ensure that each PlayStreet activation provides children and adults with safe, supervised outdoor spaces, offering activities such as sports, games, dancing, and other opportunities for ongoing to moderate, vigorous physical activities for a minimum of duration of 3 hours. In some cases, that is the minimum, but there are events that may exceed that. They may hit the 4 to 6 hour mark. That's all contingent on the organization that plans out the event. And as long as there is some alignment with or some communication with CDPH and the delegate agency, that may be possible. But at the minimum, they have to make the 3 hour mark. And the recruitment of community-based organizations, recruiting 17 CBOs per region, 34 total, and each responsible for implementing 5 activations, 5 events in each priority community area. So non-negotiable community areas for this grant will be East Garfield, Inglewood, North Glendale, West Inglewood, and West Garfield. These 5 priority communities are non-negotiable. These communities have to be prioritized or serviced, along with the remaining community areas that are we'll be sharing in the next slide. So along with those 5 priority communities, these are the community areas that have been identified through our PlayStreet Index that is combined with access to mental health, access to also based on the life expectancy gap data that we have on the Health Atlas. So for the West region, Archer Heights, Austin, Belmont Cragen, Brighton Park, Douglas, Gage Park, Hermosa, Humboldt Park, etc. South region, Armour Square, Burnside, Chatham, Chicagoland, Fuller Park, Greater Grand Crossing, Oakland, Riverdale, and so on. So these are additional community areas that can be prioritized and through recruitment and through a two-step phase of recruitment for the CBOs. The first phase or the first step of recruitment would be asking the CBOs to provide or submit an LOI, a letter of intention, to make sure that we have coverage in each community area. And once those community areas are covered, then we'll ask those agencies to submit a full RFP or application, and they provide information about their model that they'll be utilizing to plan out their event. Eligibility requirements. Respondents eligible for funding opportunities must meet the following criteria: be a non-for-profit agency with a 501c3 status, have an office located in the city of Chicago, which the agency offers services, be in good standing with the city of Chicago, and have the administrative, organizational, programmatic, information technology, and fiscal capability to plan, develop, implement, and evaluate the proposed project. Agencies with limited capacity to administer the fiscal responsibility associated with the program may choose to subcontract with a fiscal and reporting agency to provide administrative services. So for instance, there have been situations or we've had agreements or grants provided to one organization that has collaborated with two other organizations to provide the different aspects of the grant. So one agency will provide the fiscal responsibility, another one will be responsible for the delivery and the overall project management, and the other entity will provide other type of support, like for example, like providing the tools, the play equipment for the programming. And as far as required documentation, these are all documents that need to be submitted at the time of this proposal submission. IRS 501c3 tax exemption determination letter, copy of the respondent's article of incorporation, copy of the respondent's most recent financial statement. If the respondent receives more than $500,000 in federal funding during the most recent year, a copy of their audit conducted in accordance with the OMB audit requirements, list of respondents' board of directors, including the name and place of employment, a minimum of 3 letters of support from the community-based organizations or partners who they're operating with, and intend to prioritize those communities, demonstrating that they have experience working with those communities, and also a work plan. That work plan must include the recruitment, training, and reimbursement plan for CBOs, a comprehensive outline of the plan activities to coordinate and execute PlayStreet events or activations, and a description of the marketing and communication strategy to raise awareness on the PlayStreet program. So these proposals are going to be evaluated in 2 phases. Phase 1 will be the technical and eligibility review. CDPH staff will review and assess the respondent's compliance with the adherence of the state submission requirements of the RFP. So make sure that their required documentation has been submitted along with their work plan. Respondents who do not meet this eligibility requirement will not have their application evaluated, and incomplete applications will not be evaluated for the funding opportunity. Once they've met that threshold of eligibility, they'll move into phase 2, where the proposal will be evaluated by a panel or a committee of evaluators who will review the qualifications, experience, and the strength of the proposals and the plan of service for delivery. And based on that, they will develop a criteria, make sure they meet the criteria, and they will be providing points to score each proposal and determining who the winner is. The committee is consistent of recommendations of potential awardees from whom may need clarification on RFP response or a list indicating the recommended awardees. And all recommendations that are provided by the committee, evaluation committee, will be presented to the Commissioner of the Department of Public Health for their awareness and support. So the criteria for the evaluation consist of these following categories: 11 points for the community reach, 9 points for alignment with CDPH guiding principles, 40 points for the program design, scopes of work, activities, and outcome, 10 points for staffing plan, 10 points for budget justification and fiscal capacity, 10 points for organizational experience and capacity, and then 10 points for quality improvement, evaluation, compliance, and data management, a combined total of 100 points. So to be able to submit a proposal for this grant or for these two RFPs, you need to have access to the internet and also be able to access iSupplier. And this is through the procurement service, the Department of Procurement Services. And you have the website there. And again, obviously respondents are required to have internet access with an email address. The city does not provide hard copies of this RFP for clarification or an addenda. Respondents are required to submit a response via the city's online procurement system. And those questions will be answered and provide those answers through the procurement system. The timeline and contact for the RFP. The deadline for the questions is 5 p.m. Central Standard Time on November 14th. For question submissions, please submit them to myself, Miguel Lopez, 2 at cityofchicago.org. And the proposal deadline is at 12 p.m. Central Standard Time on December 5th. Please submit your responses to the e-procurement. iSupplier vendor portal restriction is required, so you do need to, if you don't have access to iSupplier, you do need to register to be able to submit the proposal and allow 3 business days to complete the registration. And with that being said, are there any questions?
Thank you, Miguel, and thank you, Yvonne. Question on for the delegate agency, are there required or minimum staffing levels to facilitate the program?
That is, no, there is no staffing requirements. So there is I want to say a 10% indirect off the budget. But from my understanding, that is not enough to fulfill a full position.
Um, Hello everyone. I'm sorry I'm late or whatever. We didn't get chance. I didn't get the link. Um, so would I be able to get a copy of the slides? And we can just go through the slides, Tiffany and I, and then we can reach back out to you, Miguel or Yvonne. Sorry.
Yeah, Bridget, I noticed that you couldn't get in, so the link that I sent you, there's gonna be a recording, and you have
Okay.
until Friday for questions.
Okay. Okay. Thank you.
Are there any other questions, Lillian or Bridget?
No, no.
Not at this time. Thank you. I appreciate you.
No problem.
Thank you,
Feel
Lillian.
free. If there are any changes and if there is a request to redo this bidders conference because of the issue with the link, please pay attention to the link that you received before and on the city's website. It'll be back on there if there's going to be a second bidders conference.
Okay, so we were notified, well, I was notified that that we was having a meeting today. So I have to actually go on the website to get the link. If any,
This is if we're going to do a second bidders conference, it'll be on the website. But knowing Bridget, just because you came to this one and you were late, we will let you know specifically the two of you. If you wanted to come back to this, if there's a second bidders conference, we will inform both of you so that
yes,
you
okay,
have another opportunity.
okay, okay, thank you.
No problem. Bridget, where are you from again?
West Side Community Empowerment Center.
Thank you.
Empowerment Center, yes.
All right, if there are no further questions, we can end this. We'll end the recording. And like I said, we will let you know via email if there will be a second bidders conference, okay?
Okay, so sorry, one second, one more
And
question. So
ask all questions you want.
okay, so when we leave, I could just go back into the link and listen to the recording.
we're going to send you a copy of the recording.
Okay. Okay. I didn't know how it
Yeah,
worked.
it will be available. Once we end the recording, it'll be on the meeting invite, and it'll be available through the chat. It'll be there. But we're also going to share it across our social media, and then actually our PIO will also add it to our YouTube channel, so it'll be online for you to be able to view too.
Okay. Okay. Thank you.
Miguel, will it be available as soon as this recording is over?
We would have to go through our internal channels to make sure it gets published, but it will. No, it won't be like today, but it will happen.
Okay.
I'm not sure of the turnaround time, but it'll happen. Yeah.
Okay. All right, everyone. Thank you so much.
Okay.
Thank you.
And if you have any questions,
Thanks,
Bridget, you
everyone.
know where to find us.
Okay. Okay.
All right. Take care. Bye-bye.
Take care. Bye.